How you doing, sir? My name is Ryan. Today we're just going to go over a quick health history assessment. I'm just going to ask you serious questions, all right? So can you tell me your name and date of birth, please?
Connor Coffeneffer, born March 31st, 1998.
All right, perfect. Can you tell me what brought you in here today to the hospital?
My stomach hurts.
Your stomach hurts, all right. Can you tell me when it started?
A couple days ago.
A couple days ago. And is it like, it's like your stomach is like right in the upper part of your abdomen? Like, can you tell me like the location of your stomach
Yeah,
pain?
it's like right here.
Okay. It doesn't like go to your esophagus or anything. All right. So how often does how long does the pain usually occur?
For a couple hours after it.
All right. Can you describe the pain? Is it like burning, or is it like a stabbing pain, or like
It's like a scan.
stabbing pain? All right. Have you used any signs or like types of relief to ease the pain?
Yeah, I take Tylenol, Tylenol.
You take Tylenol? Okay. How often do you take it?
Just when it starts hurting.
Has it been seeming to work?
Yeah, a little bit.
Okay. So, also, have you been taking, or like, besides medications, have you been using any other types of relief that you found?
No.
Like, certain type of food affect the pain in your stomach?
Just any kind of food.
Okay. All right. So, besides Tylenol, do you have any, not Tylenol, sorry. Do you have any allergies pertaining to food allergies or environmental allergies?
That I know of.
All right. Have you had any, have you had any history of your stomach infection or like a cystitis or like inflammation before, like any ulcerations?
Nothing like that. No.
No GI bleeding? Okay, just checking. Now, what about your family? Has your family had any signs, or like not signs, but like past colon cancer?
No.
All right. Have you been keeping up to date with your vaccinations?
Yep.
Yeah. All right. Now, I'm just going to ask you, if you don't mind, do you smoke?
No.
Do you drink any alcohol?
Yeah, I do.
You drink alcohol. So how often do you usually drink during the week?
About 2 times a day.
Okay. Now, have you had any problems with using any drugs?
No.
All right. So now I'm just going to go through your whole body system, just to like review some of your systems and just to ask you a series of questions. All right. So, do you have any issues with feeling weak, or having any chills, or having feel like you are tired all the time?
No. Nothing like that.
So have you had any issues? Have you noticed in your skin, like any lesions or rashes, or like random moles that have popped up that you're concerned about? What about any signs, like with your head? Like, are you dizzy more than often than you can remember? Or have you had like blurred vision or drainage from your nose?
No.
Ring in your ear, or like sore throat, or something like that? Okay. Now, what about any neck stiffness, or like neck pain, or any signs like goiter? Okay. So, have you had any trouble or difficulty breathing?
No.
Or have you been coughing a lot, or like with that coughing, have you been coughing up any blood or any sputum?
No coughing.
Okay. Just checking. So, regarding your heart and cardiovascular system, have you had any issues regarding or noticing any heart murmurs,
No.
or chest pain,
No chest pain.
or like any high blood pressure?
No.
Okay. So, also regarding your stomach, have you had any signs of nausea or vomiting because of your stomach?
When it hurts, I get nauseous.
You do get nauseous, okay. But have you had any signs of with your stomach? So you say you don't have any ulcerations in your stomach, though? All right. Now, have you had any cramping or deep vein thrombosis, or any like clots, or you notice, or like throughout your blood flow, or throughout your peripheral vascular system?
No.
Okay. Have you had any issues with urinating, like urinating any pain, or urinating with pain,
No.
or urinating any blood, or urinary retention? All right. Have you had any joint stiffness or muscle like weakness, muscle atrophy, or any lack of motion, range of motion with any of your joints? Or okay. Have you had any issues with anxiety or depression,
Nope.
Or recent thoughts of suicide?
Nope.
Okay. What about any signs of numbness or tingling in your hands or extremities? Or have you had any recent loss of memory?
Nope.
Alright. Have you had any signs of anemia, like feeling weak?
Nope.
Okay. Or any blood loss?
No.
Okay. Or any signs of bruising throughout any of your muscles? Okay, we're almost done. So lastly, have you had any issues with your thyroid, your parathyroid hormone?
I think so.
No signs or symptoms of like an increased calcium or decreased calcium?
Nope.
Or have you like had an increased urge for water, like you've been very thirsty or hungry lately?
Nope.
Okay, so I'm done with doing the questions with the systems. So I'm gonna let your healthcare provider know, and we'll get back to you to see if we can figure out what's wrong with that. All right, thank you.